There is something I need to say, something that has been weighing on me for a very long time. And I know that the moment I say it out loud, some of my colleagues are going to be upset with me. But after more than 2 decades in medicine, after watching what happens to people when they follow every single recommendation that comes their way without stopping to think, I can no longer stay silent. Here is what nobody really wants to admit. Sometimes the worst thing you can do for your health is to get too many medical tests. And that is especially true once you have passed the age of 60 or 65. I can already hear some of you thinking, but isn't a doctor supposed to tell me to check everything? Isn't prevention the whole point of all this? And yes, that is exactly what we have all been taught. Catch it early. Find the problem before it becomes a real problem. Stay on top of everything. That is the message we hear everywhere. But what if I told you that this message leaves out the most important part of the story, the part about what actually happens after something is found? Because here is what they do not mention in those health screening advertisements. Once something is found, anything at all, even something that would never harm you, the wheels start turning. And sometimes those wheels roll right over your quality of life. Today I'm going to walk you through 4 medical tests that I see causing more problems than they solve, particularly for people over the age of 60. I am not doing this to frighten you away from doctors. I am doing this because I want you to understand what you are signing up for before you say yes to every test that gets offered to you. 1. The cascade effect, the mechanism nobody ever explains to you. Before we get into the specific tests, I need you to understand something that fundamentally changed the way I practice medicine. It is called the cascade effect. And once you have seen it, you cannot unsee it. Here is how it works. You go in for a screening test. Let us say you feel perfectly fine. You are living your life, going about your business as usual. The test comes back and shows something. Maybe it is a spot. Maybe it is a shadow. Maybe it is a number that is slightly outside the normal range. That finding might be completely harmless. It might have been sitting there for 20 years and could sit there for 20 more without ever bothering you. But here is the problem. The doctor sees it and now has to do something about it, because what if nothing is done and it turns out to be serious? So you get sent to a specialist. The specialist orders another test, a more detailed one. That test perhaps shows the same thing, still not entirely clear. So now we are talking about a biopsy, a procedure, or possibly even surgery. And each one of those steps carries its own risks: infection, bleeding, complications, anxiety, and lost time. And here is the hardest part to accept. At the end of all that, 9 times out of 10, you find out it was nothing. It was never going to hurt you. But you have been through months of worry, you have had procedures done, perhaps complications, and you are in a worse state than when you started, all because of a test you had when you were feeling perfectly well. That is the cascade, and it all begins with a single test that you perhaps never needed in the first place. 2. The 4 medical tests that do more harm than good after 60. Let us start with the first test that triggers this cascade over and over again. This one is particularly tricky because it sounds so intelligent, so modern, so preventive. I am talking about whole body scans, those full body MRIs or CT scans that promise to check everything all at once. You have probably seen the advertisements. Come in, we will scan you from head to toe, we will catch anything before it becomes a problem. It sounds amazing, does it not? Like getting a complete picture of everything going on inside you, and I genuinely understand the appeal. The idea of knowing everything, of being in control, is incredibly attractive. But here is what actually happens in reality. Let us say you are 65 years old, you feel great, you are active, you have no symptoms of anything whatsoever. You decide to get one of these scans just to be safe. A few days later, you receive your results, and right there in the report, the radiologist mentions something: a small nodule in your lung, 3 millimeters, roughly the size of a pencil eraser, or perhaps a cyst in your kidney, or a spot on your liver. The report says, follow-up imaging recommended in 3 to 6 months. How do you feel in that moment? You walked in feeling healthy, and you walked out being told there is something inside your body that needs watching. You probably cannot think about anything else. Every time you take a deep breath, you think about that lung nodule. Every time you feel anything in your side, you think about that kidney cyst. 3 months later, you go back for another scan. Maybe the thing is still there. Maybe it is slightly bigger. Hard to say. The radiologist recommends seeing a specialist. The specialist, wanting to be thorough, recommends a biopsy. And a biopsy is not a minor thing. It means anesthesia. It means inserting a needle into your lung, your kidney, or wherever this thing happens to be. It means a risk of infection and a risk of bleeding. And here is what the research actually shows. When healthy people over the age of 60 are scanned, something unusual is found in almost everyone. I am not exaggerating. We are talking about 90 to 95% of people. Little spots, little cysts, little shadows. The medical term for these findings is incidentalomas, things discovered by accident. And the vast majority of them, and I truly mean the vast majority, will never cause any problem whatsoever. They are simply the marks of a body that has been around for 6 or 7 decades. They are like wrinkles on the inside. But once we find them, we cannot ignore them, and that is precisely when the cascade begins. Research has followed people who had these whole body scans, and do you know what was found? The people who were scanned did not live any longer than those who were not scanned. They did not avoid any diseases, but they did have significantly higher rates of anxiety, depression, and unnecessary procedures. The scans did not make them healthier, they made them sicker. The second test that concerns me deeply touches on something we all fear as we grow older: a brain MRI for minor memory issues. Here's the typical scenario. You are perhaps in your mid-70s and you have noticed that sometimes you cannot remember the name of an actor you like, or you walk into a room and forget why you went there. Normal things, the kind of things that happen to everyone as they age. But perhaps your children are worried, they have heard about Alzheimer's disease and they are frightened, so they push you to get a brain scan just to check. I understand that fear completely. Nobody wants to think about losing their memory, about losing themselves. But here is what you need to understand. Getting a brain MRI for mild forgetfulness is almost never helpful and is often harmful. Because here is what happens. You get the MRI and a few days later you are sitting with your doctor reading the report, which mentions terms like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. These words sound terrifying. They sound as though your brain is deteriorating. But here's the truth. Those findings are completely normal for someone in their 70s. They describe what every brain looks like at that age. It is like scanning your skin and being shocked to find wrinkles and age spots. Of course they are there. That is what skin looks like at 75. The third test on my list surprises people because it seems so logical. I am talking about stress tests for the heart, specifically putting someone on a treadmill simply because they have reached a certain age. Here is the typical situation. You are perhaps 72 years old, and you are going in for some routine surgery, nothing major, perhaps a hernia repair or a knee replacement. And the hospital protocol says that everyone over 70 needs a cardiac stress test before surgery. So even though you feel fine, even though you can walk a couple of miles without any chest pain or shortness of breath, they put you on a treadmill. Think about this for a moment. If you can walk several miles in your daily life without any problems, what exactly is the treadmill test going to tell us that we do not already know? Your daily life is your stress test. You are already passing it every single day. But protocol is protocol. Stress tests have a very high rate of false positives in older adults. That means the test says something is wrong when nothing is actually wrong. And once that test comes back abnormal, you are on the medical conveyor belt. A cardiac catheterization gets scheduled, an invasive procedure with its own set of risks. And often, once inside, exactly what you would expect to find in a 72-year-old heart is found. Some plaque buildup, some narrowing, but nothing requiring stents or surgery, nothing that was about to cause a heart attack. But now you have been through an invasive procedure, and worse still, you have been labeled as a heart patient. The fourth test on my list, and I know this one will be controversial, concerns colonoscopies after the age of 75. More specifically, routine screening colonoscopies, when your previous ones have been normal and you have no particular risk factors. To be absolutely clear, I am not against colonoscopies. They are a fantastic tool. I recommend them starting at age 45 or 50. They prevent colon cancer by allowing polyps to be removed before they become cancerous. If you are in your 50s, 60s, or early 70s and you are due for one, please get it done. But every medical test is a balance between benefit and risk, and that balance shifts as we get older. The benefit of a colonoscopy is preventing a cancer that, if it develops, takes 5 to 10 years to cause problems. But if you are 78 or 80 years old, is that benefit still worth the risks? Because colonoscopies do carry risks that increase with age. The preparation, which can leave an older person seriously dehydrated and physically weak. The sedation, which in older adults carries greater risk of confusion or breathing difficulties. And the most serious concern, perforation, a tear in the wall of the colon. As we age, the colon wall becomes thinner. The risk of accidental tearing roughly doubles or triples after age 75. And a perforation is a surgical emergency that can mean the end of independent living for someone in their 80s. 3. What you should do instead. Rather than submitting to whole body scans, focus on how your body actually functions. Can you climb 2 flights of stairs without getting winded? Can you get up from a chair without using your hands? How is your balance? How is your sleep? These functional measures tell us far more about your true health than any scan ever could. If you want a real health checkup, sit down with a doctor who will take the time to talk with you, who will go through every medication you are taking, because I can guarantee that at least one of them is probably doing more harm than good, and who will talk with you about your diet, your level of physical activity, and your social connections. Those things, the ordinary everyday things, are what actually determine how healthy you truly are. For memory concerns, there is a much better way to evaluate the situation. Simple tests that can be done right in the office in 10 minutes, remembering 3 words, drawing a clock, counting backwards from 100 by 7s. Simple things that actually measure how your brain is functioning, not just how it looks on an image. And if those tests reveal a problem, then we start looking for causes. And here is something important. Most causes of memory problems in older adults are reversible. It could be a medication that is making you mentally foggy. It could be low vitamin B12. It could be depression, which very often shows up as memory trouble in older people. It could be sleep apnea cutting off oxygen to your brain at night. It could be a thyroid problem. We check all of those things first, and you would be amazed how often fixing just one of them brings the memory right back. For heart health, if you want to know your future risk, there is a much better tool than a treadmill test, the coronary calcium score. It is a quick scan that takes about 5 minutes. No treadmill, no needles, very low radiation. It measures how much calcium, essentially hardened cholesterol, is present in your arteries. The result is a single number. A 0 means a very low risk of heart attack over the coming years. A high number means you need to get serious about prevention through diet, exercise, and possibly medication. But the key difference is that the calcium score gives you your risk level to guide prevention. It does not automatically send you down the road of invasive procedures. It gives you information so you can make informed choices. For the colon after 75, the answer is not to ignore it entirely, but to shift from invasive screening to smart surveillance. Pay close attention to symptoms, persistent changes in bowel habits, blood in the stool, unexplained abdominal pain or weight loss, anemia. These are genuine red flags. At that point, regardless of age, a colonoscopy is necessary, and invest in the power of your diet. Fiber, fruits, vegetables, legumes, and whole grains are the single best things you can do for your colon with absolutely 0 risk. 4. The true definition of health after 60. You have noticed the pattern running through everything I have told you today. It is always the same cascade. One test leads to another, which leads to another, which leads to a procedure, which leads to a complication. And somewhere along the way, the most important question gets forgotten. Is this person actually better off? Here is what more than 20 years in medicine has taught me. Health is not about having perfect test results. Health is about function. It is about being able to do the things you want to do. It is about enjoying your grandchildren, taking walks, reading books, living your life without fear and without unnecessary medical interference. The goal at 65, 70, or 80 is not simply to live longer. It is to live better with independence, with dignity, and with joy. And sometimes the best way to protect all of that is to say no to a test that is going to send you down a rabbit hole you have absolutely no need to go down. I am not saying avoid all medical care. I am saying be a smart patient. Ask questions. When a doctor recommends a test, ask why. Ask what happens if the test finds something. Ask what the risks are. Ask whether there is an alternative. And then make a decision based on what genuinely matters to you. You are in charge of your health, not the protocols, not the computer reminders, not the clinical guidelines. You. And the more you understand about what you are agreeing to, the better the decisions you will make. Because sometimes the healthiest thing you can possibly do is nothing at all.